Hello and welcome to this edition of the Podium, which is coming to you live from the Sierra Leone Broadcasting Corporation with me, Asmiba. We start our program with a quote of the day, which comes from Robert H. Scholar, and it says, "Problems are not stop signs, they are guidelines." Coming up in today's edition of the program, West African Drug Policy Network calls for change in some countries' drug laws and to give its human rights a touch. What's the prospects of Sierra Leone's tourism sector? The Minister of Tourism will tell us, and the Case Memorial Hospital to be commissioned in Freetown. All these and more, including your messages, which you can send to 099517746. 099517746 is the number you can send your messages to. The program is Podium. In an effort to raise awareness on the impacts of drug trafficking in a public forum through television and radio platforms, will soon commence in 5 targeted countries of Benin, Ghana, Cote d'Ivoire, Liberia, and Sierra Leone. The program will be done through the West African Drug Policy Network with support from West African Civil Society Institutes and the Open Society Initiative for West Africa (OSIWA). The forum will engage citizens on the need to have drug policies that will be human rights sensitive, public health and harm reduction. Well, in the studio, we have a member of the West African Drug Policy Network, Arasi Sapong. Welcome to the program, Mr. Sapong.
Thank you very much.
What was the background to this policy first?
Well, in the run-up to United Nations General Assembly Special Session on Drugs in 2016, there was a lot of international debate on whether or not the UN treaties on drug control, the legal regime, was working. Whether or not the scarce resources many developing countries have are being properly used to control drugs. And whether or not the goal of the UN convention was being rolled out in good policies or in bad politics but good politics. We realized that bad policies were good politics for politicians. So that if you could parade 100 peddlers and small, users, nonviolent users of cannabis in the streets, and say that that is the indication that you are doing well, and you are not even arresting one single drug baron, people think that that is good politics. But that clearly is bad policy, because those who control the illegal trade are those who benefit. There's an illicit market through prohibition, and who benefits? It is the elite or barons who have connections with politicians who are benefiting. And we thought that the earlier we proposed an open, wide-ranging debate that looks at all options.
Can that chain be broken? The connection between the drug barons and the elites?
And that's why we're saying that there are options. Prohibitionism allows for an illicit market that is controlled by barons, who, once they control it, they have their connections. Because all the monies they are making from the big West Africa, why is West Africa becoming a major transit center, or became a major transit center? Why? There were no intelligence agencies in West Africa? There were no intelligence agencies in the various countries? People close their eyes to it? It cannot be so. Because the people have access to, it may not be politicians, but it may be law enforcement agencies. So all we are saying is that if government A has $100 million for law enforcement, why do you use $20 million to arrest peddlers? Why do you put somebody who is just using a small amount in jail, and then you also take state resources to look after him? The goal of drug policy is simple this: it has to be reasonable, sensible, and it has to be public health focused. Because if somebody suffers from malaria, where do you take him to? You take him to hospital. It's a public health issue. If you have not been able, the state in West Africa, every West African state has folded its arms, not been able to deal with the production of cannabis and all these things. And people have become addicted to it. Whose fault is it? It is their moral fault? Excuse me. It cannot be their moral fault, because there is corruption all over the place, and that is not morality. That is a structural thing. It is not, I don't want to blame politicians. I was the youngest minister under Rawlings in Ghana. I was a minister at the age of 25 years in 1982. You know? And it is possible to be an honest politician, but at the same time, it is also possible to be put under a lot of pressure. So it is about systems. It's not about people being moralistic or other things. So all we are saying is that there are risk factors that can lead people to drug addiction. There are protective factors. Let us recognize that that is science. It is simple science. The risk factors are there. The protective factors are there. When you come out of a policy, drug policy, and it's not just about narcotics. In Ghana, like in Sierra Leone, there is tramadol, a problem. People are misusing diazepam. I'm a pharmacist and a lawyer also. So these are things that are clear. Illicit drugs are also being misused. Michael Jackson, he died of overdose. That's the point we're making. So all we are saying is that if narcotic drugs are dangerous, why don't you treat it like antibiotics and bring it under regulation? It is important. Once you regulate it, you can then regulate a pricing system. We are not saying that people should smoke publicly. We are not saying that. So what we are saying is that when you divert into public health, then you are dealing with those who are addicted. But you put in more money for prevention, education. So that, because go to any prison in West Africa, Francophone, Anglophone, look at the people who are incarcerated with drugs. Petty, non-violent offenders. When everybody knows, every government knows that alcohol and tobacco are more dangerous than cannabis. So why would anybody put his head like an ostrich in the sand? It is criminal for governments in West Africa and in Africa and in the world to allow the lobby of tobacco and alcohol to continue this, whereas they demonize people who are using drugs. And that is all I'm saying. That all we are pleading with government is that look at the policy again. Look at the various options. And let us move. We are not saying legalize. All we are saying is that put more resources into public health and human rights. For example, human rights. Why would you allow somebody who is on remand to remain in a prison that is meant for convicts? A remand prisoner is not guilty. He's not guilty. So why would you put remand prisoners when you know that your resources are such that you don't have remand prisons? Give them administrative fines. Let them do I see good public education about cleaning Sierra Leone, Ghana cleaning Ghana, Nigeria. Get them to do community work. You know, so the prisons are overcrowded. There's an alternative to incarceration.
But if you also look at the way marijuana, for instance, is being used, you can see the trace between marijuana and also crime.
Yeah.
You cannot divorce it.
You know, listen, the elite, particularly political elite. As I've been in government for 13 years, I was the youngest minister under Rawlings. We were proud to have put Ghana on track. And I'm saying that it is very easy for the elite, both political and academic, to tickle themselves and bring about assumptions that are not real. I mean, where in this country, I challenge every government in West Africa and in Africa to bring the connection between crime and drug use. The criminals are the drug traffickers. The criminals are the big time guys. They are organized criminals. I'm saying there are risk factors why people use drugs.
What about those who consume it and the criminals?
Yeah, but there are risk factors why they consume it. There are risk factors. There are risk factors. Part of the risk factor is that the family breaks down. People do not even take care of their children. You know, you and me, and maybe Mr. Minister and the young man here, may have been lucky by the grace of God that we didn't fall prey. It's not because we were morally strong, but there are some homes. You go into a home, and that home is completely shattered. a mother of so many children. There are factors, clear factors, that are risk factors. And let us address it as a scientific public health problem. Again, let me state that it is wrong to smoke marijuana. It is wrong. There are many wrong things we do. But when somebody smokes it, it is a human, just like tobacco. That's the point I'm making. Just like tobacco, just like HIV. When HIV began, churches and mosques, religious people will say, why should you distribute condoms? But that was the reality. And when the message was clear and the arguments were convincing, everybody came on board. So we are not saying that tomorrow the policies must change. All we are saying is that we are pleading with governments, we are pleading with parliamentarians, we are and saying that, look, recognize that if you are in government, you are not the most knowledgeable. Mr. Minister spoke about tourism. In doing so, he admits that he has a ministry of technical people who do work. So those technical people, there are also civil society guys who are technical people, who necessarily are not in government, but who can be beneficial. We engage civil society. We cannot take over government because we are not elected to govern. All we are saying is that listen first, hear our voice. We are stakeholders. Please join and let us have the various options. Okay. Once we have the various options, I'm sure that we can come with solutions.
Okay, he is a member of the West African Drug Policy Network. Your support. The program is a Podium coming to you from Freetown. Send your messages to the number you see on the screen. We are back with the program Podium, which is coming to you from Freetown with me, Asmiuba. And so, Mr. Zapong, you've heard the text messages. That will take me to, if you read history and imagine the slave trade. The colonial masters, Britain and others, once they had made profit out of it, they attempted to abolish it. And that was the time others went into the trade. And so many agreements were entered into. It became very lucrative. And to put an end to it was very difficult. I'm painting this scene where I think that's the same thing that is happening now in West Africa. West Africa has now become a hub for drug trafficking.
Well, the attitude is not to be a fatalist. Because if we were fatalists, we would have said, once the colonial guys had been here with all their resources, then we could never get independence. But there were struggles for independence, real struggles, in spite of the fact that our people didn't have those resources. But our confidence was in our people. So what is important is that we shouldn't throw our hands into the air. This is a debate. And you'll be surprised what Kofi Annan, former Secretary General of the United Nations, who oversaw the implementation of the UN Drug Conventions. After he left, he set up a West African Commission on Drugs, on which the Honorable Justice Bankole Thompson, Supreme Court Judge of Ghana, of Sierra Leone, is on. The chairperson is Obasanjo, His Excellency Obasanjo, who was a former Nigerian head of state. They all recognized that even when they were in office, the regime they supervised is falling apart. It is not working. It is about evidence. What is the evidence? Does prohibitionism take away the illegal drug market? No. So it is important to open a new chapter and a new debate. It will take a long time. But because we are not fatalists and we are realists, we will engage. What is important is incremental gains. This is not a revolutionary movement. It's a reform movement. So we need to be confident, because the reform movement, we are running along with the river downstream. The prohibitionist movement is running upstream. It is not working. But the other point is that there are several. The question was about whether West Africa is ready. But again, I agree. We have a lot of challenges. But that is why we shouldn't push our governments too far. We should allow for incremental. For example, I think that the first thing to do is to start with some research in our research institutions on the medical use of cannabis. People don't realize that before 1830, most of the paper in the world was produced from cannabis plants. It's important. Why do we import jute bags and ropes when we can grow another type of cannabis sativa called hemp, the hemp plant, which is a little bigger? You see, in our laws we say cannabis sativa is banned, but there's cannabis sativa that is grown for the THC, and then there's cannabis sativa, hemp plant, which is grown for the rope.
Have you ever used cannabis sativa?
No, I haven't used it myself. But I know people who use it. Respectable middle class guys in Ghana who use it.
But they hardly come to the public to say they are using it.
Yeah, they hardly ever come to the public, but they will tell you secretly that they support it. But the point, they support this movement because of the stigmatization. People say, we have in Ghana, the language for Indian hemp is Abunsam Tawa, devil's tobacco. That is a stigmatizing language. Even the language, the narrative is wrong. That it means that God has a tobacco which is white man's tobacco. But that white man's tobacco is killing us. You get the point. So it is extremely important for us to, for example, let me give you an instance. You arrest 5 tons of cannabis. You go to a farm, then you go to court and you say you should ban it. It's not the fault of the prosecutors or the judge. We need to engage the judiciary, we need to engage the prosecutors. As a scientist, I'm engaging the prosecution in Ghana. And as a lawyer also, I'm saying that, look, when we go to court, let us not burn the cannabis. Because why do you burn the cannabis? You are chemically changing the nature so that it cannot be used as cannabis sativa for smoking again. That is the essence, the science of it. But if you burn, it's combustion. So what we need to do is to convert the cannabis into briquet, hardened charcoal under pressure, which is being used in many hotels all over the world. So our people would no more be cutting down trees because there's a lot of deforestation. Go to the villages, they cut trees to make charcoal. Let's convert this and sawdust and other things into briquettes so that is economically useful. Look, it is a scientific use because the conventions are against the use, the non-medical and non-scientific uses. But Master, what is scientific? When you convert something into industry, it is science and technology.
Mr. Sapong, you've had the text message, and what has been your engagement with the governments of West Africa?
Well, we, as civil society, of course, we write to our various governments. We engage with our ministers. In the drug policy, it is normally the ministries of health and the ministries of internal affairs or interior. So in a lot of our programs in country, we invite the police, the Ministry of Health, the Minister for the Ministry of Interior. And then also, whenever we have fora, we do presentations, and then what we do is that every quarter, we belong to the West Africa Civil Society Institute. So there is some, how do I put it, a briefing paper for governments on the things that we see as relevant to drug policy, and of course other civil society advocacy issues. It is true that we need to do a little more, But like we are saying, we are looking at the various stakeholders. This is the time when we have, on the 26th June every year, there is what we call the International Day Against Drug Abuse and Trafficking. So that is why we are doing this TV thing. And obviously the fact that we are doing it in 5 countries this year, of course, we didn't mention Nigeria because Nigeria is a specific case, and they have their own program in country.
Okay.
So we are hoping that next year we'll be able to cover all the 15 countries.
Thank you very much, Mr. Sapon Yusuf.